So, in honor of World Rheumatoid Awareness Day, which is February 2nd, we decided to make a video addressing some of the most common questions and misconceptions that are associated with rheumatoid arthritis. RA is one of the most often misunderstood and ignored chronic illnesses out there, so hopefully this puts some of those questions to rest. Let's dig right in. First, rheumatoid arthritis, like all arthritis, only affects old people. Wrong. As evidenced by this 29-year-old svelte hunk sitting before you. Rheumatoid arthritis, or rheumatoid disease as some call it, affects people of all races, all genders, all persuasions, and yes, all ages. There are babies born with it who can't turn over in their cribs because their little joints are swollen. And then there are people who develop it in their 70s and beyond who not only have to contend with rheumatoid arthritis, but also have to contend with regular or osteoarthritis as well. RA knows no bounds, and there's no rhyme or reason that determines when or where it hits. Okay? Next, what does RA feel like? Well, this is a tough one. If you don't have the illness, it's difficult to describe, but let me see if I can put something into words. Okay, imagine you came across a professional wrestler in a bar after you've had more than a few drinks, right? And you walked right up to him and you told him that he loses all his matches because he hits like your grandma and he smells like her too, right? Now imagine what it would feel like when you woke up the next day, hungover, folded into neat quarters, and stuffed into a mailbox. That's close to what it feels like, except for the fact that you never know when that wrestler is going to show up again and stuff you into the proverbial mailbox. It could be 5 months in a row, or it could be 2 days and then nothing. That's pretty close to what it's like to live with RA. Okay, next. Have you tried ... Oh, if I had a nickel for every time I heard, RA, have you tried? Right? I think many of us with RA have heard that same refrain. And the answer is yes. I've tried copper bracelets, cracking my knuckles, exercising, no wheat, vegan diets, resting, shark fin, acupuncture, not cracking my knuckles, not exercising, eating less, eating more, removing stress, chiropractors, supplements, glucosamine, massage, and finally, just stopping thinking about it since it's all in my head anyway. I've tried it all. And despite what your uncle's roommate's former yoga instructor who visited Thailand and brought back secret herbs heretofore unavailable in America says, it won't work for me. RA is an incredibly individual illness, and what works for one person probably won't work for another. Your concern is appreciated, but your turmeric is not. Next, is it contagious? Yes, I've actually heard this one more than once. It's funny, but it's true, and it just goes to show how much people don't understand about rheumatoid arthritis, okay? They think it's hereditary, right? But there's some cases like mine that just show up out of nowhere. But just to put minds at ease, still, you can't get RA by someone coughing on you. You can't get RA from a toilet seat. And you can't get RA from having sex with someone. Although, I'd be happy to test that last one with anyone who may still be unsure. Especially now that I'm single. No, it's fine. Finally, what is the difference between osteo or old people arthritis and rheumatoid arthritis? Well, this one is pretty simple. Osteo or old people arthritis is the deterioration of a joint due to wear and tear and or injury, right? Pretty easy. Now, on the other hand, rheumatoid arthritis is what's called an autoimmune illness. This means your own body immune system went cray-cray one day and decided that joints were totes basic and OMG, they gotta go, right? So your own body starts eating away at the cartilage and the joints, and sooner or later, you end up with something that looks like my feet, where one resembles a boomerang and the other one resembles a dumpster on fire. That's about right. Anyway, that covers the most common questions I get about rheumatoid arthritis and rheumatoid disease. Sure, there's much more info out there, right? But this was just a short video in honor of Rheumatoid Arthritis Awareness Day, which is February 2nd. We hope you learned a few things. If you liked the video, please subscribe, share it, comment, email if you have any questions. I'll respond. In the meantime, remember, as always, be kind, rewind, and keep on keeping on. Talk soon.